Hello, my name is Inos and welcome back to my channel. This is Work and Wonder. If this is your first time, please consider subscribing to the channel. Turn on the notification bell. Anytime I post a video, you'll be notified and you'll come straight here and take a look at whatever video that I have posted. So today we'll continue with our Mental Health OSCE series, and today we'll be talking about one of the silent stations. I know that most of you have been requesting for stations like the assessment and some other stations, but then as I said, it's a series, and then I'll be coming your way almost every week with one episode which will cover at least one of the stations. I already have a video on the assessment station, which is a depression with suicidal ideation phase. I'm yet to upload that for the manic or for mania, so just be a little bit patient and I would upload that video. So today, the planning station that we'll be doing, our problems that we'll be using, we'll take them from the assessment that we did. So if you've not watched that my video, I'll tag it along here and then you can go back and watch it, because there are some problems that we were able to identify, and those are the problems that we'll be using to draw our care plan. So basically, the planning stage or the planning station is a silent station. When we say silent, it's a station that you do not talk, you do not do anything. All you need to do is to write your answers for your assessor, and it is a 14-minute station. So you need to complete this station within 14 minutes, and you will need to address two problems or write two care plans based on the problems that you identified in your assessment stage. So what it means is that 7 minutes each for the two problems that you'll be drawing the care plan on. And aside that, we also have basically or mainly two types of care plans. It either is a community based or is an admission based. Community is the patient is still being managed in the community, and admission is either the patient is in a hospital or is in a care home. I'm saying this because when you are doing your assessment, basically you will determine at the end whether the patient should be admitted to a hospital or the patient should remain in the community for treatment to continue. And most people in the assessment, once they admit the patient, in their mind, when they are coming to draw their care plan, it is an admission based care plan that they are going to draw. But that is not the case. It could be that in your assessment, you admitted the patient, but you come to the planning station, and when you read the scenario, it tells you that the patient is still in the community. In this case, you are going to draw a community-based care plan. So it's as simple as that. So you are going to draw your care plan based on the scenario that is given you in your planning stage, not on the assessment or the outcome of the assessment that you did. A lot of people have made this mistake because they drew their care plan based on the assessment, and the scenario said the scenario was a different setting. So please, this is something that you need to take note of before you start writing. Yes, and you'll be given a sheet where at least three sheets, the first one for the first care plan, the second one for the second care plan, and then the third one for if probably you make a mistake, you can simply cancel one of them and then you can transfer all the answers on the third sheet, which is more or less like a backup sheet. So what happens? The very first thing is that you'll be given a scenario and you will need to read your scenario. Based on the scenario, you'll be able to know whether you are drawing a care plan for a community-based or an admission-based, and then you can start your care plan. So let's go straight onto my computer and then I will show you how these sheets look like. So yes, as you can see, this is the very first part, which is the scenario. So in this case, you can see the candidate paper and briefing, planning, and then the scenario is here. So with this particular one, it says that Terry was referred by the GP who attended the mental health clinic this morning for low mood with suicidal ideation and social isolation. A mental health assessment has been carried out, and Terry has agreed to work with the primary care mental health team to explore interventions to manage his depressive phase. So if we are looking at that, this is clearly a community-based. This one, there was no need for admission. He has agreed to work with the primary healthcare team, which in this case is the community mental health nurses, to explore interventions to address this depressive phase. So your care plan will be a community base. And if you go down, you will know that you have to address two relevant aspects of the nursing care. So here, the two problems that you identified in your assessment, you use that to draw your care plan. So now that we know that it is going to be a community based, now you go to your sheet, the other sheet that will be given you. So you can see the second one here, it has the patient information, and then we have a nursing problem, we have a nursing aims and care, we have re-evaluation frame, and then we have the nursing care and intervention. But I always advise people that once you are given these sheets, there are two of them. Scroll down or go to the second one. The last one has the name, the nurse signature, and date. Make sure you put your name here, you put your signature here, you put your date, the date, that particular day before you even start writing. Because if you write, you do all your care plan, and at the end, there was no time for you to write your name and all these things, you will still be failed because you did not document. And anything that has that doesn't have your signature, the date, and then your name, it's assumed that the documentation was not done by you, and therefore all the effort that you put into writing this care plan will just go to waste and you will fail. So let's go to another one that I have here. It's the same thing, but then I have drafted some answers based on the problems that we identified in the assessment stage. So as you can see, it's still the same scenario here that I have. And then I have my name here. As you can see, I've put in my name in red because you would have to put your name there. This is to show you that that part is important, which says a candidate name. So you can see my name, Enosh Fragrance. And then I also know that it is a community based because the patient has agreed to work with a primary care mental health team to explore interventions to manage his depressive phase. So now let's go to the answers. So the very first problem, if you remember or if you've watched my depressive phase assessment video, you realize that the very first problem that we identified was low mood, right? So low mood. So here, the nursing problem or need will be that Terry is experiencing low mood related to moderately severe depression as evidenced by PHQ-9 score of 17 out of 27 and by verbalization. If you watch the video, you realize that we had a PHQ-9 and then we failed it, and the total was 17. And then 17 out of the 27, because you have 9 questions and the highest the patient can score is 3. So 3 times 9 will be 27. So the low mood is the main problem here, and it is related to moderately severe depression. This was the provisional diagnosis that the PHQ-9 gave us. It's related to that, and then it's evidenced by what? The PHQ-9, and then the patient also verbalized that he's been feeling low in mood. Here, remember that we don't use NANDA. In the UK, there is nothing like NANDA diagnosis. You will address the problem straightforward. So Terry is experiencing low mood. We are very straightforward with our problem. That is the problem, or the problem stroke, the need. So Terry is experiencing low mood related to moderately severe depression as evidenced by the PHQ-9, which you failed, and by verbalization. Now let's go to the aim of care. Aim of care simply means what you seek to achieve. Here, Terry will verbalize an improvement in mood evidenced by PHQ-9 score of less than 9. So basically, what you are looking out for within that time period, that is what you write as your aim of care. Now let's go to re-evaluation. Re-evaluation is the time interval that you'll be re-evaluating this particular problem to see whether the patient is making progress or not. So here to be re-evaluated by 5th of 12, 2023 and every 2 weekly, and if clinical condition changes in the community. You remember that I said this is a community-based care plan. So everything we are going to do will be in the community, and mostly patients that are in the community, they are visited every 2 weekly, or the nurse goes there every 2 weeks. So it is only when you go there within that 2 weeks that you'll be able to re-evaluate. As simple as that. Now let's go to the nursing intervention and self-care interventions. Here, most people, or if you've watched a lot of video, they use the acronym EMATARID. Here you can also use that, which you have the E is the explain, the M is the monitor, then you have A as assessment, T as a teach, you have A as administration of medication, you have R as refer, you have I as instruct, and then you have D as document. you can also use that here to make your care plan very, very simple. So the E, which starts the matter read here, is explain and discuss all aspects of care to Terry in the community because they're community based, and gain consent. Terry has consented to this treatment in the community and has the capacity to do so. So that's the very first nursing intervention stroke self-care intervention. Now let's go to the second one, which is the M. So the M is what? Monitor and record Terry's vital signs on every visit and escalate as per news to policy. Here, every visit, because it's in the community, it's only when you go there to visit the patient that you can take your vital signs. Now the A is assess. So here you assess Terry's mental status, especially mood, affect, thought, behavior every 2 weekly. And the self-care intervention is that Terry has agreed for this assessment. Now let's go to the last one, or let's go to the fourth one, sorry, which is offer Terry one-on-one time to verbalize his thoughts and feelings on every visit in the community. And then the self-care, as usual, will be he has agreed for this support. Now, when we go to the T, still under the T, you can say that involve family members of Terry to offer diversional therapy whenever feeling down in mood. Here, you cannot, it is only when you are with the patient that you can offer diversional therapy, but then most of the time it is the parents or the family that are with the patient, so you have to involve them to, try as much as possible to offer diversional therapy, because you will only be there every 2 weeks, or as and when the clinical condition changes, that is where you will be required to go to the house to do this particular one-on-one. So you would have to involve the parents or the family to help, with the diversional therapy. Now let's go to the A, which is supposed to be administer prescribed medication, but in the community, you don't administer the prescribed medication, but what you do is that you encourage Terry on every visit to adhere to prescribed psychotropic medications and give education on the effect and side effect if needed. So that will be your job with regards to the prescribed medication. Now the next one will be the refer. Here you refer Terry to the community psychologist for talk therapy and then psychiatrist for medication review. Here you'll be very specific to be the community psychologist and then psychiatrist who you refer to, not the ward, because you are still nursing Terry in the community. Now, the I, which stands for instruct, is you instruct Terry to call GP at working hours whenever feeling down in mood, or 999 or 111 for emergencies. As simple as as simple as that. And then, as usual, the last one will be document all care plan and provided. So you can see that we have still used the acronym EMATARI, which is the EMA TERID, which will help to make your nursing intervention and self-care interventions very, very simple. So this particular problem was low mood, and then you can see that we have addressed that. Here, almost everything is going to be the same thing, but when you get to the teaching, you can see that there were some specific interventions which addresses the low mood. For instance, here we talked about assessing the thoughts, the feeling, the behavior is very specific to low mood. We also talked about giving the patient one-on-one, which also addresses the low mood. And then we also talked about involving family members to provide diversional therapy. So each problem always have spams, each of the problems always have some specific nursing interventions, at least two of them that will address it, because the other one seemingly remains the same. The other ones, which is explaining the medication and all of that, they remain the same for all nursing interventions. But then it is the teach aspect that will have to address those specific problems. Now let's go to the second problem. The second problem that we identified was that Terry is at risk of self-harm, which is related to severe depression, evidenced by PHQ-9 score of 20 out of 27 and by verbalization. So this is another problem that we identified, and then we will write our aim of care, our reevaluation, and then nursing intervention. Thus, you can see that I did not write the aim of care, I did not write the reevaluation, I did not also write the nursing intervention, because I intentionally left it blank so that whoever is watching this video, try and write the aim of care, try and write the reevaluation, try and write the nursing interventions, and I'll leave my email under the description. You can email it to me and then I'll take a look at it to see whether you are on the right track or there is some corrections that needs to be done. So the second problem, which is the problem of self-harm, I will leave it here. I'll try and tag or put this particular page in a Google Drive and then leave the link in the description. So when you click on it, you can have access to this particular page, and then you can do, or you can write these ones directly on them, and then you can email them back to me and I'll take a look at that. So basically that is it. And then when you come down here, you can see that I have my name, I have my signature, and I have the date. As I said, if you don't write these, then you will fail it, because something that is not documented is seen as is not done. And that will be it for the plan. And there's also another third page, but this page is for when you make an error with the first two, then you can utilize this page. All you need to do is just to put a strike to cancel the whole thing, and then you can recopy it back to this page. So this page is more or less like a backup if you make any mistake with the very first two sheets. But hardly would anybody make mistake, but people do make. Then you will just recopy it back. Some people also say that the spaces are kind of too small for the write up, but I can see, as you can see, I have more than 7 or 8 interventions here, and there are still a lot of space left here. So it is up to you to know how to write. If you have very, very big handwritings, you have to make sure that you reduce it so that you can have all the interventions down here. As simple as that. And all this you need to do within 14 minutes. So basically that is it for the planning stage. This particular one was very specific to depression with suicidal ideation. When I'm done uploading the video for mania, I also try to upload a care plan for the problems that we identified in that mania assessment here, and then we'll get to address that. I hope that this video has been helpful. If it has, please make sure you subscribe to the channel and then share, turn on the notification bell. Anytime I post a video, you can come here and take a look at the video. Until I see you in my next video, it is a bye for now.